Alright, let's dive into something that's been making headlines recently: rabbit fever. Yes, you heard that right. Rabbit fever. Sounds like something out of a quirky sci-fi movie, but it's very real, and it's popping up in places like New York. Personally, I think what makes this story so intriguing is how it blends the rare with the relatable. We're talking about a bacterial illness that's been around for ages, but suddenly, it's in the spotlight again. Why now? And more importantly, why should you care? Let's break it down. First off, rabbit fever, or tularemia, is caused by the bacterium Francisella tularensis. It's not something you hear about every day, and that's because it's rare. Fewer than 200 cases reported annually in the US since 2019. But here's the kicker: it's not just about rabbits. What many people don't realize is that this bacterium can lurk in ticks, deer flies, and even contaminated water. It's like a hidden threat waiting to pounce if you're not careful. And that's what makes this really interesting. It's not just a disease of hunters or rural folks, it's something anyone could potentially encounter, especially during outdoor activities. Now, let's talk symptoms. Tularemia doesn't mess around. It starts like a bad flu: high fever, chills, body aches, but then it throws in some curveballs. A sore or ulcer where you were bitten, swollen lymph nodes, even eye irritation if you've touched infected animal tissue. What this really suggests is that the body is fighting off something serious, and the symptoms are its way of sounding the alarm. But here's the catch: these symptoms can easily be mistaken for other illnesses, which is why it's so hard to diagnose. If you take a step back and think about it, this is a classic example of how rare diseases can fly under the radar, even for experienced doctors. One thing that immediately stands out is how tularemia spreads. It's not contagious between people, which is a relief, but it's incredibly versatile in how it infects us. Tick bites, contaminated water, handling infected animals, it's like the bacterium has a playbook for getting into our systems. From my perspective, this highlights a broader trend in infectious diseases. They are often opportunistic, exploiting our interactions with nature in ways we might not even consider. It's a reminder that even in our modern world, we're still very much at the mercy of these tiny, invisible invaders. Prevention, thankfully, isn't rocket science. The CDC recommends using insect repellent, wearing long sleeves and pants, and being cautious when handling animals. But here's where it gets tricky: how many of us actually follow these guidelines religiously? Personally, I know I've gone hiking without thinking twice about ticks. This raises a deeper question: how much responsibility do we take for our own health when it comes to preventable diseases? It's easy to brush off these recommendations until something like rabbit fever shows up in your backyard. Treatment, on the other hand, is pretty straightforward. Antibiotics are highly effective, which is a far cry from the days when tularemia was a death sentence. A detail I find fascinating is that there used to be a vaccine, but it's currently under review and not widely available. This is a perfect example of how medical advancements can be both a blessing and a frustration. We have the tools to fight this disease, but access to those tools isn't always guaranteed. What this really suggests is that even in the 21st century, we're still playing catch-up with some of these rare but dangerous illnesses. So, why is rabbit fever making headlines now? In my opinion, it's a combination of timing and awareness. Summer is peak season for ticks and outdoor activities, so it's no surprise cases are popping up. But there's also a growing awareness of these rare diseases, thanks in part to social media and increased reporting. What makes this really interesting is how it reflects our evolving relationship with nature. As we spend more time outdoors, we're also exposing ourselves to risks we might not fully understand. It's a double-edged sword: we crave connection with the natural world, but we also need to respect its dangers. As we wrap this up, I'm left with a thought-provoking question: how prepared are we for the next rare disease that comes our way? Tularemia is just one example, but there are countless others lurking in the shadows. From my perspective, the key is not just in treatment or prevention, but in awareness. We need to be curious, cautious, and informed. So, the next time you're out hiking or handling animals, remember, rabbit fever might be rare, but it's a reminder that nature always has a few surprises up its sleeve. Stay safe, stay informed, and maybe keep that insect repellent handy. Thanks for watching.